Hey guys, welcome to Southern California EMS Training Institute. My name is Tyler Andrews, and today we're going to be going over how to properly set up an oxygen tank and then how to administer oxygen through a couple different devices that we have to go ahead and administer oxygen to a patient. First thing we want to do is we want to go ahead and set up our oxygen tank, make sure it's ready to go. So I got an oxygen tank right here. First thing I want to do is make sure I have my PPE on, my personal protective equipment, before I go ahead and start any of my skills. After that, I'm going to go ahead and I'm going to start and I'm going to check my tank out, make sure there's no cracks or any damage to this tank, make sure that it's actually intact before I go ahead and use it. Other thing we can notice about this tank is green is the color of oxygen, so whenever we see that we've got a green tank, we can know that oxygen is the gas that's going to be inside of this. So, a couple safety features of oxygen tank: you should never open it up next to a flame or in and around a flame or fire, or any patients who are smoking. Right, oxygen is very flammable, can cause some major danger or major damage to those patients or yourself. And then also, we want to make sure that we try to keep one hand on the tank at all time if it's going to be standing up like this, or lay it on its side. That way it doesn't fall over, doesn't damage the tank, and potentially cause the tank to become some sort of projectile or missile or something else, because these tanks are charged. So after this, after I check and taking a look at my tank, I'm going to go ahead and I'm going to make sure that where my oxygen comes out of is nice and clean. And so I'm going to go ahead, what I do is I just crack the tank a little bit to the left. So I go shh, and then close it up really quick. Right? That does a couple things. It allows me to know that there's actually oxygen inside of this tank, and then also any dirt or dust or debris that's inside this little valve can be blown out, and I make sure it's nice and clean and intact, ready to use for my patient. After that, I want to go ahead and I want to hook up my regulator. Now I should make sure that my regulator is also intact. A couple things I check for is, first I'm going to take right up in here, make sure that I've got an O-ring inside of my regulator. I make sure my gauge isn't cracked at all. And then I want to look for these two little prongs right here. These prongs are going to help me to attach it appropriately to my oxygen tank. So these two little prongs should get lined up exactly with these two little holes right next to my oxygen tank. So I'm going to take this, slide it right on my tank, and I'm just going to screw it down. Now once my regulator is on my oxygen tank, all right, it's nice and secure, now I'm going to open my oxygen tank and actually charge my regulator. So I'm going to pick up my oxygen tank key and I'm going to open my tank, right, just 3/4 to 1 turn. That's it. You don't need any more than that. I should be looking for a couple things. Number one, I should be hearing if there's any leaks coming in or out of this tank or this regulator at all. I should also be checking my gauge to make sure that my tank is full. Right? So a full tank will be read at 2,000 psi, and then an empty tank is considered anything 500 psi and below. If it's lower than 500 psi, we should be changing that out because it's probably not going to last us a whole nother call. From there, I also want to take a look at my flow rate, and I can find that right here. I can actually adjust it, right, to make sure that I have oxygen coming out, and then the oxygen should be coming out right here at this very bottom port. Now that I have all of these things done, my oxygen tank is set up, it's ready to be used on my next call, and I can go ahead and administer oxygen to my patient. So I'm going to go ahead and lay my tank down and make sure I keep it safe. I'm going to select my first oxygen device, which is actually known as a nasal cannula, or nasal prongs. You can see here, right, that my nasal cannula has these two little prongs that are actually inserted into the patient's nose, and then this tubing wraps around my patient's ear and up around their neck. So that's going to be able to administer low concentrations of oxygen to my patient. Now the flow rate for this is going to be anywhere from 1 to 6 liters per minute. So I'm going to go ahead, I'm going to stand my tank up, I'm going to connect my nasal cannula directly to this port right here. And I'm going to select 4 liters per minute, since that's halfway between 2 and 6. I got on 4 liters per minute. Now I'm able to actually administer it or put it on my patient's face. I want to take my nasal cannula and I want these prongs, you can see they have a little bit of a curve to them, to be inserted in my patient's nose and kind of follow the pathway of their nasal cavity. So it's going to go actually inside their nose, right, all the way up. It's going to go around their ears just like this, as best we can with this guy who has no ears. And it's going to go just tie up right underneath his chin, just like that. And it's going to be held onto this patient's face, right? And he's going to be able to get low concentrations of oxygen, right? And it's going to be able to support his breathing or his circulation. Now, if I decide that my patient needs more oxygen than a nasal cannula can actually deliver, right, then what I'm going to go with is I'm going to go with my non-rebreather mask. Now, this is my non-rebreather mask right here. Now, my non-rebreather mask is able to give high concentrations of oxygen. This is really beneficial for any patient who's maybe in shock, or maybe any patient who is having respiratory distress or respiratory difficulty. So in order to use this, right, my flow rate is actually going to be 10 to 15 liters per minute. So I'm going to stand up my oxygen tank. I'm going to connect my tubing right back here. And I'm going to turn it all the way up to 10 liters per minute. Once I got my oxygen tank on 10 liters per minute, I'm going to lay my tank down. And I need to go ahead and fill up my reservoir bag before I go ahead and put this on the patient's face. So in order to do that, you take your finger and you put it right here over the little valve, almost right where the nose goes, and you just fill up this oxygen tank, or fill up this reservoir bag, sorry. After this is all nice and full, we're going to go ahead and we're going to put it on our patient's face. The little green strap should go all the way behind your patient's head. All right, and the mask should just go right on their face. Now, a couple things we can do to make sure this is fitting appropriately, right, is it's got a little metal bar here. Just bend that over your patient's face. Helps get a nice seal around your patient's nose. And then we've got these two little green tabs on either side. We just give it a little pull to make sure that's nice and snug on your patient's face. And we're delivering the right amount of oxygen here. Now again, maybe my patient is having respiratory problems, right? But my patient's not breathing very well on their own. Just spraying oxygen in their face isn't really going to help that patient very much. So we might want to use a different type of device to deliver that oxygen. In that situation, right, where your patient's not breathing very well, we need to actually use what we call a BVM, or bag valve mask. Now our bag valve masks come with a couple different sizes, so you want to make sure that you select the appropriate size for your appropriate patient. And then you want the appropriate mask as well. Some of these masks comes in different sizes, and we want to make sure that we have a good seal around the patient's nose and mouth area. This is your adult BVM. Right? These adult BVMs can be actually pretty large and can deliver quite a bit of breath to your patient. Now, the thing we need to know is the patient really only needs about half of this bag. You don't need to squeeze the entire bag into the patient's lungs. This is a pediatric, right, or a child BVM. Again, you can see the mask is a little bit smaller. The bag is a little bit smaller because, again, we don't want to overfill their lungs. And then here's our infant BVM. Again, the mask is even smaller, and the BVM is even smaller, right, because we want to deliver even less breath to them. Now, my patient today is an adult patient, so I'm going to go ahead and select the appropriate one, which is going to be the adult BVM. I'm going to attach it to oxygen. My flow rate for my bag valve mask is actually going to be 15 liters per minute. So I'm going to go ahead and I'm going to turn that up to 15 and lay it back down. And I'm going to make sure that my reservoir bag fills prior to putting this on the patient's face. So once I have my oxygen all ready to go, I'm going to put this over my patient's nose. I'm going to use a CE grip, right, to get a good mask seal. And I'm going to do a nice head tilt chin lift to open up that patient's airway. And I'm going to breathe for this patient one breath every 5 to 6 seconds if they're not breathing well on their own. And this device helps push the oxygen down into their lungs, where these other two devices don't necessarily push it down in your patient's lungs to help them breathe. So that is the benefit of your BVM or your bag valve mask. That's how to administer oxygen. This is, again, Southern California EMS Training Institute, so thank you guys so much for watching.